Good day, fellow learners. Once again, this is your mentor, your fact check buddy, Gapuz. This time around, we have our new sets of pointers for you, and this is going to be under a new format. We're going to be doing the case study format. So, this is going to be case number 1 for your next generation NCLEX RN tips, only from the Ray A. Gapuz review system. Before we get to start, I'd like to ask you, I'd like to knock on your good heart and soul to please do join us in this mission. Our goal is to provide free NCLEX application and review to 100 nurses for this year. We've done it successfully in the past 2 years, and we want to help more. So to help us achieve this, just watch and finish the ads in our videos. And thank you in advance for doing so. Now, on to our next generation NCLEX RN case number 1 set of pointers. So before we begin, let me share with you this inspiring letter. Let's learn from her success recipe. First of all, I want to give God all the glory, honor, and praise, for without Him I am nothing, and with Him I can do all things. My NCLEX journey was never easy. I had challenges and struggles during my review, and there were times that I would just want to give up. But I thank God for giving me the best support system, and that is my family. I have to agree. And 100% I agree. I would also like to thank Sir Ray A. Gapuz for boosting my self-confidence. It works whenever I say I believe that I'm next, because everything starts with believing in yourself. One of my struggles during my review was my difficulty catching up on my online classes because I have 3 kids at home, so I have to find a program that would work for me. And the bootcamp and face-to-face quick fix was just so perfect that I had 3 of each. It is where you can experience how hands-on Sir Ray is. It is where he helped me build my mental prowess and stamina in answering difficult questions, because NCLEX is not about memorization, but it's about critical thinking and analyzation. As I always say it, if you cannot analyze, oralize. I'm just kidding. Okay, and then she goes on to say, NCLEX is not easy. It will drain everything that is in you. So you have to make sure that there is something that can be drained from your brain. So don't take the exam unprepared. And that's a key strategy, because by failing to prepare, you're preparing to fail. Thank you, sir, for your dedication and for pouring your heart and your soul in making sure that your students will pass the exam. Continue to be God's instrument in changing people's lives. God bless you more, sir, and all of your staff who are all super accommodating and super kind. I will recommend Ray A. Gapuz review system. Even for NLE, that's a nurse licensure exam, that's a local examination for nursing here in the Philippines, or the NCLEX, everywhere I go, the best of the best. Thank you for the kind words. To ITAP's Gapuz Processing, thank you so much for helping me process my papers flawlessly. Their processing is just so flawless that once you enroll in your program, you won't worry about your NCLEX application, and all you just have to do is to focus on your review. They are very accommodating and responsive in answering queries. God bless. To all my co-nurses who are aspiring to become a USRN, believe that you are next. Then do your best and God will do the rest. Don't forget to pray. That's coming from Joanna Pasquin Viado from the University of Cordilleras. That university is in Baguio City, New York Board of Nursing, who passed the test last May 14, 2024. So, on to our first case, and this is going to be about peripheral artery disease. So I have some visuals here just to remind you of what could potentially happen when you have occlusion of a peripheral artery. So you would notice that in the first illustration, we have an area of the leg in which the blood vessel is obstructed, and the obstruction is caused by the accumulation of fats, and we call this arteriosclerosis, okay, atherosclerosis, and that leads to arteriosclerosis. Now, when you say atherosclerosis, that's the building of fatty plaques or cholesterol plaques. that could potentially lead to the hardening of the artery. So from atherosclerosis, it leads to arteriosclerosis. And when there's now an obstruction of the blood vessel, definitely there's going to be poor blood circulation, and comes with it would be poor oxygenation in the area that could lead to necrosis. Now, notice that in clients with peripheral artery disease, there is no or minimal edema. So either you don't have edema or very minimal edema. So the main symptom that an artery is obstructed would be pulselessness or a diminished pulse. So you would also notice that in clients with arterial obstruction, the ulceration could be dry. So two things that you have to remember to differentiate arterial from venous obstruction. In arterial obstruction, you have minimal or no edema. In venous obstruction, you have edema. In arterial obstruction, you usually have dry skin ulceration, while in a client with venous obstruction, there's usually wet skin ulceration. Now, on to the other important aspects of today's case. So peripheral artery disease occurs when the arteries are narrowed, leading to decreased blood flow to the arms and the legs. In peripheral artery disease, the decreased blood flow to the legs lead to a symptom which we call claudication. Now, when you say there's intermittent claudication, there is pain that is worsened with prolonged walking and then relieved by 1 to 2 minutes of rest. So if you want to assess the occurrence of intermittent claudication, you simply just have to ask a patient to walk for a couple of minutes, and then when they begin to experience leg pain, ask them to take a seat and rest for 1 to 2 minutes. If the 1 to 2 minutes brief period of rest will relieve the pain, then that would tell you that the client could be having intermittent claudication. Take note of how to assess intermittent claudication. So peripheral artery disease is manifested by, I have your code, which I formed, pallor. Once again, that's a copyright, and it is registered under the trademark of the Ray Gapuz system. So pallor stands for P, painful cramping. That's intermittent claudication. A, absence of pulse or weak pulse in the legs or feet. L, leg numbness or the presence of tingling sensation. L, loss of hair on the legs or slow growth of toenails. So you could see hardening of the toenails or very, very minimal leg hair on the especially on the lower legs. Then observable changes in skin color. So there's pallor because of decreased blood circulation, and of course, recurrent trouble getting an erection. So it simply means it could also be associated with the diminished blood flow into the genitals. That's why there's a difficulty for the male client to have and sustain an erection, okay? So the ankle brachial index or ABI is a test to diagnose your peripheral artery disease. So ankle brachial index involves comparing the blood pressures in the ankle and the arm. The blood pressures are measured before and after walking on a treadmill for a couple of minutes. So they would note if there's any discrepancy in terms of the blood pressure at the ankles and the blood pressure at the brachial area, meaning the arm. So remember that the farther the body part from the heart, normally the higher the blood pressure is. So it should be that in a normal individual, the blood pressure in the lower extremities is usually higher than the blood pressure in the upper extremities. Now, the priority goals of care for a client with peripheral artery disease include, first and foremost, definitely the main symptom is intermittent claudication described as pain. So you have to decrease the pain. And second is to maintain the health of the arteries. Now, how do we deal with these goals of care? How do we achieve these goals of care? So we can achieve these goals primarily through the use of drugs, and the drugs for clients with peripheral artery disease given to achieve the priority goals of care include primarily to decrease the pain. You will have to give your cilostazole. So it's a drug that thins the blood and it widens the blood vessels. A common side effect could be headache and diarrhea. Or another alternative drug would be your pentoxifylline. Side effect would be gas pain, dizziness, including nausea and vomiting. Now, pay particular attention to the fact that your cilostazole and pentoxifylline can thin the blood, and so therefore, if the client is taking blood thinners, you have to caution them that they have to clarify it with their physician, because taking these drugs for peripheral artery disease could potentially worsen their bleeding tendencies. We also need to remind them and ask them if they are taking herbal remedies such as ginkgo biloba or ginger, even ginseng or chamomile. These herbal remedies could potentially also worsen bleeding. So never take drugs that have a blood thinning characteristics with herbal remedies that could potentially worsen the bleeding tendency of a client. Second goal is to maintain the health of the arteries, and we begin with your anti-cholesterol agents, your statins like atorvastatin, lovastatin, simvastatin. Now take note that your statins are hepatotoxic, so these are best taken at dinner time, but you have to check your liver function test. And then, of course, aspirin, which is also a blood thinner, but it helps maintain the health of the arteries. Your clopidogrel, which has also a blood thinning effect, so it may also worsen the tendency of the client to bleed. And of course, your antihypertensives, which could promote vasodilatation, thereby relaxing the blood vessels and promoting adequate circulation of blood in the area. Now, what should be the discharge instructions for clients with peripheral artery disease? So first, don't smoke, quit smoking, and then eat healthy, specifically low-fat diet to control the cholesterol so you can maintain the health of the blood vessels. Avoid over-the-counter cold remedies like Sudafed, Advil colds, as this may tighten the blood vessels and therefore can potentially worsen intermittent claudication. And then we have to tell our clients to regularly wash and dry the feet. They can apply moisturizers like your Aveeno lotion, but not in between toes, because the area in between toes, when they are applied with a moisturizer, is a good culture medium for bacterial growth. So that could potentially lead to complications. And 5, use well-fitting shoes with thick and dry socks, specifically your cotton socks. Those are very, very important things that we have to tell our clients. So once again, before we move on to our case for the day, let me share with you our passers from more than 30 countries worldwide who have experienced how it is to be under the Ray Gapuz system. So here's our case number 1. A 35-year-old male who is a smoker since 17 seeks consult at the emergency room for leg pain that disturbs his sleep at night. Further assessment reveals that the pain is relieved by dangling the legs at the side of the bed and walking around the bed for brief periods. Now, pay particular attention to this. However, the pain has become increasingly bothersome and has not improved with walking lately. Let's analyze this. So initially, the pain is relieved by dangling the legs at the side of the bed because that helps in the circulation of blood in the area, and then walking around the bed for brief periods. So the brief periods of walk could actually relieve the pain, but eventually when you walk in terms of longer distances, so that could potentially now impair blood circulation, and that could make the pain worse. As it is stated in the last sentence, the pain has become increasingly bothersome and does not improve with walking lately. So the question related to case number 1 is, the nurse should anticipate treatment of the client to include phenylephrine, vasopressin, silomethazoline, or cilostazole. Now take note, phenylephrine, vasopressin, and silomethazoline all could potentially cause vasoconstriction. And so therefore, these drugs are not appropriate for the treatment of a client with peripheral arterial disease because they can worsen vasoconstriction of the arteries and could therefore worsen the symptoms of the condition. So the drug of choice would definitely be cilostazol because that thins the blood, and at the same time, it relaxes the blood vessel, leading to adequate blood circulation. So when there's adequate blood circulation, there's adequate oxygenation, and then eventually the pain will lessen. So the answer is actually number 4, cilostazol. So I hope you learned from that case. The second thing that you have to remember when you're preparing for the next generation NCLEX RN would be you have to learn how to study using technology. You have to learn how to navigate questions using technological features of the computer. So here at the Gapuz system, we have our learning tools published by the largest publishing companies in the world related to health sciences literatures. That's Johnson Bartlett USA and Mosby Elsevier. And we also have our own course shells that contains all the subject matters that are covered on the test, like safety and infection control, basic care and comfort, health promotion and maintenance, management of care, physiological adaptation 1, 2, and 3, psychosocial integrity, reduction of risk potential, and all of these things will cover the concepts that you need to master for the test. Okay, and the third requirement to pass NGN, you have to be in a conducive environment. Here at the Gapuz system, we keep our classes in a comfortable size, and definitely we have our own next generation NCLEX simulation room that simulates the actual test experience for the learner. And here's what Mark Lester Halaron Amolo would share, is actually one of our recent passers. I highly recommend this review center, the Ray A. Gapuz review system for the NCLEX RN. With the knowledge, skills, and expertise and holistic approach of Dr. Ray A. Gapuz and all the mentors and staff, my entire review experience was a blast. It had given me the chance and confidence to pass my exam with their help and guidance. The Think First strategy, that's very unique to the Ray Gapuz system, and syndromic approach, another set of strategy that's unique to the Ray Gapuz system, helped me a lot on how to attack the next generation NCLEX RN questions geared with basic functional concepts that is very unique to the system. From all the series of lectures and paper and computer-based tests during the quick fix and bootcamp experience down to the simulation exam, I can proudly say that I am a certified Gapuz baby from the MLE, that's the Philippine Nurse Licensure Exam, to the NCLEX RN. My sincerest gratitude to Sir Ray and to all the mentors and staff of RAGRS for making the first step of my American dream a reality. Thank you so much, sir, and God bless you. Mark Lester J. Amolo, USRN, Texas Board of Nursing. Our heartfelt congratulations to you, Mark Lester. May your thrive increase. Okay, so we'd like to extend this invitation to everyone who would want to experience the unique way of learning from the Ray A. Gapuz review system through our next generation NCLEX RN Flex, the most flexible test prep class for the NCLEX RN. It's your choice if you want to join me in a live face-to-face class. You can do our 10-day bootcamp. The next bootcamp schedule would be in July 15 to 27 in Baguio City, the live virtual class, on-demand unlimited video recorded lessons, including our Q bank and the use of our course shells, 3 books, and that's included in the fee, your my NGN strategies and sample questions, plus our quick fix sessions. Now, our fee starts at $3,499. You can choose to join the weekday classes, AM class or PM class. We have a 5-hour class if you wish. We have a 9-hour class if you wish. We also have a 2.5-hour class if you wish. So we can always customize the program based on your needs. So please do give us a call at 0906-201-9383. That's a Ray A. Gapuz system. Look for my full name, the Ray A. Gapuz review system. So with that, this is your mentor, your fact check buddy, Ray Gapuz, saying thank you for joining me for our case number 1. I'll see you back again for our case number 2. Take care. and see you in my next video.